And I am not one for long introductions. You can all Google her and find out all of the small and big facts, but I'll just name a few things that I found particularly interesting and important. Dean Botchwey's research and teaching have been at the nexus of environmental and health policy in the built environment. We actually have a new joint master's with public health.
That's wonderful.
With a special focus on youth engagement and health equity, and we'll hear something about that this evening. The impact of her public health and social justice work was recognized in 2021 with the prestigious Dale Prize for Excellence in Urban and Regional Planning, and in 2016 by the White House Council on Women and Girls. So there's clearly a gender piece in there too, right? And after positions at Georgia Tech, Emory, and the University of Virginia, she has been, she's now the dean of the Humphrey School at the University of Minnesota, where she's been for just about a year. So that's a big marker. So there's lots more, but the title of Dean Botchwey's talk, as you can see, is The Power of Youth Participation and Advocacy Towards Healthy Placemaking. So you're in for a treat. We will have questions after her formal presentation, and I'm so glad to see you all. Please join me in welcoming Nisha Botchwey.
Thank you so much. It's great to be here.
Thanks so much for coming.
Absolutely. So good evening, everyone. I'm just going to make sure I have my notes. Thank you, everyone, for coming. Let me see if I can scoot over here a little bit so you can see me a little better. I'm going to share a bit about my work in healthy placemaking this evening. That really focuses, as you can see here, on youth advocacy toward healthy placemaking. And the framework of toward is important because it's not just being aware of or proselytizing about the connection between these fields of public health and the built environment in addition to advocacy, but it's actually creating that change. So moving toward and not just pontificating. And the focus here is obviously on youth advocacy. So let me start with a little bit of background on built environment and public health. And then we're going to talk about existing approaches to addressing some of the challenges in this field. I'll highlight a bit on just one research project that I hope will be of interest to you, give you a little bit of a case study, and then I just want to end with a little bit of a discussion on public affairs leadership needs. And as the dean of the Humphrey School of Public Affairs, it is so important, especially today, that we are educating the current generation and providing that professional development and continued education to the workforce. So we have citizens that are creating the positive change in the ways that are most impactful and important to them. So let's see. So I just wanted to give you a little bit of a roadmap of where I've been. So I was born in Jamaica, immigrated to South Florida when I was 5 or so. And then the gold are the schools that I've attended. Actually, I'm sorry, the white are the schools I've attended. So I went from South Florida to Harvard University, and then on to the University of Pennsylvania here for my master's and PhD. And then finished in a whirlwind with my PhD and went on to the University of Virginia. Now you're saying, well, why do you have UVA twice? Well, at the University of Virginia, I had the opportunity to serve on the CDC. While I was at UVA, I had the opportunity to serve on the advisory council for the CDC director. So that was Julie Gerberdine at the beginning, and then Tom Friedman afterwards. And in my very first meeting at the Centers for Disease Control and Prevention, there were a ton of public health theories that I figured they were talking about, but had no clue what the conversation was about. And so instead of like raising my hand to say, what are you talking about? I enrolled in a public health degree program. And so I have an MPH from the University of Virginia while also serving as an assistant professor. I didn't have tenure at that time, but I was awarded tenure. Moved to Georgia Tech, and then now to University of Minnesota. I put this up because this was my undergraduate dissertation or thesis, and I wanted to understand the impact of coastal development on marine resources in Montego Bay. So I could say that this is my bay. I was born in Jamaica, grew up in Montego Bay, and this is the, maybe I would say it's the light that moved me toward my great interest in environmental science in particular. And then while as a student at Penn, I just found this card last night. While as a student at the University of Pennsylvania, working on my dissertation in looking at faith-based organizations and the contribution of those organizations to local community development, my parents developed type 2 diabetes. And so this aerial is of the neighborhood I grew up in. So you can see there's an elementary school, maybe middle school, there's a high school that the card is covering. And we lived in this neighborhood. You could walk to the different schools and parks. And yet my parents still developed type 2 diabetes. They were active. My dad rode his bike everywhere. My mom was a nurse, and we know that all healthcare professionals are not obese and they have great cardiovascular disease. I'm not telling the truth. And so there were some issues at play. And so I wanted to understand what was happening with my parents, given the environment that they were living in. And so that allowed me to see some of the health matters that were showing up in my faith-based organization work, dissertation work at the University of Pennsylvania. And then at the same time, I had my first child, Nayara, and then my boys, and here's my husband. And having these kids, not only was I interested in the health contributions of faith-based organizations for underinvested or marginalized communities, but I was interested now in how my kids, our kids, could have voice in having an impact on the health and well-being of their communities from their perspective, and to build their voice and muscle in doing that. And so at the Humphrey School now, I work toward that target to inspire, educate, and support innovative leaders who move toward the common good, not in the diverse world, but in our diverse world. And it's all about impact. And for me, the impact is focused on youth advocacy for physical activity, because by raise of hands, who will tell a young person that you should not advocate to move or exercise? I don't see any hands raised, right? And so that's an easy way to train and direct and support youth. And then they have the skill to do it in any arena they want to. And so as we move to a little bit of definition, the background, and then we'll hit theory. So health, we know, is a state of complete physical, mental, and social well-being, and not merely the absence of disease. It is a complete state of physical, mental, and social well-being. And so when we think about public health professionals, they're dedicated to fulfilling society's interests in assuring conditions in which people can be healthy, conditions that range from effective healthcare systems to healthy environments. And the design professionals focus on the form, function, and operation of things and spaces, right? And so these things seem to be disconnected. So we're talking about fulfilling society's interests in assuring these conditions to be healthy, healthcare systems, healthy environments. But here we're talking about form, function, and operation of things and spaces. Well, when I think about healthy places, how we connect these two things, here the focus is on places in which people can grow up, live, work, play, study, pray, age in ways that allow them to be safe and healthy, to thrive and not just survive, and reach their full potential, that complete state. And the creation and maintenance of healthy places really requires all the things written there, but basically balance. That it's balanced from the small scale of the chair you're sitting in, if you're an interior designer, the house that provides the various spaces that the family or occupants need to live well in that space, all the way to a balanced planet and a climate and navigating weather systems. It's balance. That's what healthy places is all about. How many of you are familiar with Maslow's hierarchy of needs? Just a few or most, great. So we know here that Maslow has ordered this to say the most foundational thing that's important is here at the bottom, right? So it's water, food, breathing, sleep, sex, security, family, employment, as we move up the hierarchy of needs, all the way up to creativity and spontaneity. We can't have health and fun and confidence and esteem and belonging without the foundation of this pyramid. This is critical, and when we think about a healthy place, there's the foundation from the small individual frame to the community to the planet. We always have to start here. What's the foundation? What's the context? And not just what's the context in this snapshot period of time, but how is there the compounding of the experience in that space that leads to poor health outcomes or good health outcomes? It's the compound interest of healthy exposures in space or unhealthy exposures in space. And the design professionals, those of us here, how many are design professionals? Architecture, historic preservation, planning, yes, landscape, thank you. Who else is in the room? Any other professions I didn't reference? All right, so we're all family, we're all the design professionals. We have significant contributions to make in this field. So the health impact pyramid is moving us toward that conversation. So health impact in 5 years comes from the Centers for Disease Control and Prevention. This was a framework that they published maybe about 2 or 3 years ago. And here you can see that the foundation of this pyramid, much like the foundation of Maslow's hierarchy of needs, is on the social determinants of health. So where you were born, where you work, all of those things that are foundational, and the interventions that address this bottom level are early childhood education, clean energy sources, diesel buses, public transit systems, home improvement loans, and grants that are accessible to a variety of people. So at the bottom of this pyramid, while it says social determinants of health, these are the rules of society. This is population level impact. This is policy, systems, and environmental change. This is where you have to put a lot of time and resources in. So the healthy choice is the easy choice. So the healthy choice is the aesthetically pleasing choice. So the healthy choice is accessible and expected and within reach to everybody, despite what's in your pocket. And then on the and then here, changing the context, making the healthy choice the easy choice, you can see some of those policies. At the top, counseling and education, clinical interventions, long-lasting interventions. This requires individual initiative. You have to go and get a shot. You have to go to your counseling session. Something has to be pushed in for you to opt in to do it. This is choice. This is policy. This is policy systems and environments that present the healthy choice to everyone. This is the foundation with which we work, and this is what we shape. So designers operate here. The systemic structure and the patterns of behavior. So we design these environments. This is Charlotte and their fantastic train system. This is Atlanta. And when I used to use this slide, I would say, I'm so sorry, this is where I live. I don't live here anymore. I have a fantastic train system that I use now. But in Atlanta, the system presents the choices that leads to these behaviors of driving, of road rage, of being on your own individual in your car, not interacting with individuals, not having the opportunity to stop and get a coffee or to have a walk after lunch. It doesn't present good behavioral choices that then lead to positive or negative health outcomes. We designers of the built environment control the bottom of the iceberg. But for whatever reason, we don't realize that. And so this is dated 2008. Apologies, I haven't updated the slide, but the numbers are about the same. Social conditions, so health status is determined 55% by social conditions. Those are the social determinants of health. That's what was at the bottom of that high five pyramid. Behavior, 30%. These patterns of behavior that are dictated by the systemic structure, these social conditions that we design, that we control. And then healthcare is only 10%. It's only 10% because of the compound interest that over time this leads to. And then finally, genetics. John Snow, how many of you are familiar with John Snow? Fantastic room. So 1854 outbreak of cholera in London. He was a member of the London Epidemiological Society. And essentially, well, what's the story here? What did John Snow do? Come on, you all know John Snow. You raised your hands. Not you. You can't tell me. Yes. Yes, so the Broad Street Pump. And so the Broad Street Pump was located here where you see a large number of deaths from cholera. John Snow went out throughout London with a pastor because John Snow wasn't a trusted member of this community. And so the pastor would knock on the door, the folks would open for the pastor, and then John Snow would speak. John wouldn't have been able to get any doors open. So again, as we think about design and the work we do in communities, it's really important to be mindful of who those trusted voices and engagers are, even back to the 1800s. And so he identified that the Broad Street Pump was the locus of concern for these deaths. He took the pump handle off. He redesigned the environment. He took the pump handle off. And many argue that the cholera epidemic was on its way down at that point anyway, but he was able to identify the source, take the handle off, and then see a dramatic decline in deaths that were sourced from that pump. And so I ask you, in what ways are you reshaping our communities to minimize the negative exposures and maximize positive exposures? So I'm going to show you a data slide from Atlanta. So this shows, this is from a Robert Wood Johnson Foundation project from VCU. In Atlanta, we have I-20 that kind of cuts the city north to south, and then I-85, I-75 that goes up. And up here, this is Buckhead. So what this is saying is that in the Buckhead area, people live on average 84 years old. But here in Vine City, and Bankhead, that's 71 years. And that's, what, Jimmy, 5 miles apart, 10 miles apart? 10 miles, 13 years. 10 miles, 13 years. Design matters. And good design can lead to healthier and happier people who live longer lives. So you ask, what about Philadelphia? Here's Philly. And I'm not as familiar with the Philly neighborhoods. So let's see, someone help me out. 88 years, what neighborhoods are here?
Old City Society Hill.
Old City Society Hill, that sounds expensive. All right, and then let's see, 78 years, that's not Center City, where is that?
No. Brewery Tony's slightly more north, so that's probably like Fairmount, right there.
Where the museum is, nice houses. I went running along the river there a lot. And then perhaps the area that is the worst on this map, 68 years, where's that?
No, because you have Strawberry Mansion would be right there, and then above that, you like now. Well, if that's Broad, you've got like Hunting Park up there. What's below Hunting Park would be up.
Strawberry Mansion. Well, we know the direction we're moving in, right? This is not Society Hill. This is not so I have a dear friend, Dick Jackson, who was at the Centers for Disease Control for a long time, is one of the folks who really helped to start this field, this intersection of health and the built environment. And Dick would take his students who were at UCLA in the built environment and public health class, and he'd say, everyone go to the window. So they'd go to the window and he'd look out, he'd tell them look outside, so they'd look outside. He'd say, what do you see? And they'd talk about what they saw, and there were some things that they didn't like. And he said, just because that is the way it is now doesn't mean it has to be that way always. We can change that space. And so what I want to offer to you is that a city is only as healthy as its least healthy neighborhood. And just because this is this way now, doesn't mean that it has to be this way. We can invest resources in an equitable, not equal, let me say that again, we can invest resources and policy and systems and environmental change in an equitable, not equal way to address this disparity, so the health of the neighborhood is measured in a way that allows it to be at this same threshold. So this is where I would give you a lot of data. I'm just going to give you a little bit of data on Philly, and then I want to move quickly to the youth advocacy. So this is the foundation, all right? I just want to make sure we're all on the same page. So this is from the Department of Public Health City Report, Health of the City Report. So you can see that this first chart here, the red is all residents, poverty among all residents and children in Philadelphia. And this is children 18 and younger, or under 18. And so you can see the poverty numbers or percentage for children is significantly higher than all people. And then poverty, all residents and children by race. Overall, 23 and 31% children is in blue. Black, 26 and then 37%, 12 and 12% for white, 40 and 52% for Hispanic, and then 23 and 29% for Asian. Significant disparities. Well, what does this look like for asthma? So think about our map from the policy map, link map. You can see the dark color is the higher percentage per 10,000 children for asthma hospitalization. And then you can see that the highest percentage, the highest rate for asthma hospitalization is for Black citywide, and then Hispanic. Again, disparities that likely you've seen this before. And then if we just look at these maps, or even going back to this one, we see that asthma hospitalizations, percent of people in poverty, percent children with high blood lead levels, and the lower length of life maps. Place matters. And the design and investment in these places is critical to the health and well-being, not just of all city-wide residents, but of youth in particular. So we have heard about the canary in the mine, right? That when you have indicator species that would indicate that something is wrong in an environment. For me, youth are our indicator species. There's a host of matters that we need to address with youth. And so I wanted to highlight that as you look for additional data on health in the built environment, this comes from my recent book that came out in July with my dear friends Howie Frumpkin and Andy Dannenberg. This is just one of our tables that shows the existing tools in health in the built environment. You can look at Walk Score, the AARP Livability Index, county health rankings, the NEMS tool, and there are a host of others. So there's lots and lots of resources. I'm sure your library has multiple copies of my book. If not, email them and tell them to get it. And so you can go there. So let's delve into children's health and thus youth advocacy and how we move toward equipping them with voice. And so when we look at children's health, this first chart just shows adolescents meeting federal physical activity guidelines. Again, for me, physical activity is the easy ask for youth. So they build the skill set to be able to address other issues that are important to them. And you can see that none of the groups by race are meeting the target. And then obesity among high school students. 15% total. Is that right? Let's see. Yes, obesity versus overweight. And so obesity, 15% female, 11, 18% male. And then you can see the breakdown. What is interesting to me here is that Native Hawaiian or Pacific Islander, there's no data for youth, and it's based on how they did the survey and sampling. But we know from other surveys that obesity in Native Hawaiian and Pacific Islander communities is closer to 28%, much higher than these other numbers. And so here, I just want to highlight that when we think about the neighborhoods, not the 88-year-old life expectancy, but the 68-year life expectancy in Philadelphia, that primarily is due to distressed communities. And these distressed communities have poor food access, inadequate parks, lack of community resources that do not promote physical activity. And we know, especially with juveniles, that physical activity improves their health. It doesn't improve it within the first 3 months or 6 months or even 12 months of the intervention, but it does improve it over the long term, and it improves other areas. Marginalized communities have fewer health resources than privileged communities, and specialized interventions are needed for promoting health in marginalized groups. So we know, going back to that high five table, that school-based approaches and personal behavior change motivations are standard practices for youth and health and well-being generally, and that is, again, at the socioeconomic level and the changing the context to make the healthy choice the easy choice. And so when we think about the Youth Engagement and Action for Health project, we wanted to understand the role that not just school-based approaches or personal behavior changes impacted health and well-being of youth. We wanted to understand the role that advocacy played. So if these youth became advocates for physical activity promotion, would that be as powerful an impact on their health outcomes, individual agency and well-being, as the other approaches that have been tried and are true in these other studies? And so we know that advocacy is the act of communicating with people or organizations to persuade them to take a particular position. This is not a standard public health intervention. And so as we started this a few years ago, it was novel, and thankfully the Robert Wood Johnson Foundation funded it. And so we know that successful youth programs from the literature empower youth, aid marginalized youth development of agency, efficacy, and hope. It's successful in reducing tobacco usage among youth, helps youth to gain and exercise power, and then it helps them to move from placation of youth to true partnerships with adults and decision makers. So I want to show the Arnstein ladder. So ladders of participation. How many of you, at least in planning, you've probably seen this ladder? So this is the ladder of citizen participation. You know, you move from non-participation, so manipulation and therapy, to tokenism, all the way up to citizen power and citizen control. There is a youth ladder, or ladder of youth participation. This is by Hart. By R. Hart from 1992. And so there's a slight adaptation to this, because when we think about youth, they don't receive power. There's no delegation of power to them. And there's no control, citizen control. And so there's a bit of a split. And so when we took a look at this and did some case study work, we determined that there's this interesting smaller set of steps here before you get to even partnership, and delegated power and citizen control isn't fully engaged, but there's consent. So having the youth participate and to give their consent and approval for projects, but projects that they don't author. There's advocacy, which is the Youth Engagement and Action for Health project that I'll give you kind of the study design on in just a second. And then incorporation, where they're fully incorporated in the planning process with other actors, and they're not advocating on their own as youth, as a party. And so we took a look at Growing Up Bolder, Y Plan, and then Youth Engagement and Action for Health to determine what approaches are best for different types of community, for different types of youth projects. And so I'm not going to go into detail here, but just want to highlight this is published, I think, in JAPA. So I encourage you to take a look at that. And it focuses as one of the case studies on the Youth Engagement and Action for Health project. So this is a project, it's a youth advocacy training program designed to teach advocacy for improving physical activity promotion and nutrition in communities focused on policy, systems, and environmental changes. Youth learn about advocacy, they conduct neighborhood assessments, and they complete an actual advocacy project. We developed this 12-week program targeting middle school kids. And why middle school kids? Well, they're a captive audience. They can't drive home, although they could probably take the train here in Philly. They are not busy with work or intense AP classes or other things. They're smart enough to engage in the conversation and are not going to get distracted like some of our elementary school kids. So they're the perfect group for this type of intervention. We targeted low-income students from minority backgrounds with rural, suburban, and urban communities, so all across the U.S. And they completed physical activity and attitude assessments at week 1 and their final week. And so I think these photos are from our DC, Virginia group, and this bottom one is from our Miami group. You can see that we were all over the U.S., including Hawaii. And our kids worked on projects from park renovations, sidewalk improvements in Charlottesville, Virginia, food assessments and grocery store targeted interventions in Atlanta, Georgia. And then in Miami, Florida, they actually had 4 groups, including a litter topic, a dance topic, and others. And so what did we find? Impact of the youth advocacy, policy systems, and environmental change program for physical activity on perceptions and beliefs. We found that all youth increased their number of days that they were physically active. We did not have markers of lower BMI or decreased weight, but we saw that they were much more physically active following participation in the program. Their measure on optimism for change, are they hopeful that something actually could happen as a result of their intervention or their friends' interventions, increased for rural and suburban students, but not for urban students. And we can talk a bit about why we think that's the case. Rural and urban students increased their active transportation to commute to school. And then African American or Black and Latino students decreased their fast food consumption. So we saw some really positive directional change in the participants of this study. And I'll just give a side note. One of our clubs in Florida, even after the program was over, the kids continued to wear their Yeah shirts on Fridays because they were the Yeah Club, and they were working to make sure that physical activity promotion and healthy eating continued to be a focus of their work. So I want to give you a little bit of a case study here on Hawaii, and then we're going to talk about public affairs and why it's so important that we invest in these kids. And so in Hawaii, I reached out with my project manager to 4 boys and girls clubs on the different islands. I didn't have the pastor, like Jon Snow did, to help open doors. So week after week, postcard after letter, email after email, no positive response, no interest in participating in the Yeah program. And then we were able to engage with a woman named Bev Brody, who runs Get Fit Kauai. And Bev said, oh, this would be a great program. And as soon as Bev said it, all the doors opened wide. And I just highlight that because having these local trusted voices is so important to bring resources to communities, but also to make sure that you're doing the right thing by these communities. So Bev opened the door. We worked not only with the Boys and Girls Clubs, but with the local planning agencies. And so here we are in Kauai with County Council. You can kind of see all the kids in the background of the picture on the left. And these kids are presenting on their neighborhood park, Kalena Park, that has chicken holes throughout, because like the Moana movie where you have the chicken running everywhere, that's what you have in Kauai. So chicken holes, a lot of work that needed to happen at this park. After the presentation, County Council awarded them $80,000 to do a perk study. And so imagine you're 12, 13, 14, you just hear that you got $80,000, not for yourself, but to do a perk study for this thing that you've been working on for the last 12 weeks. And so the students were quite excited. A number of things happened in the pursuing year or two, but the park study went forward and the park has been renovated as a result of the work that those middle school kids did. This was led by them. They advocated for the change and they created the change. And this is the work that is so important for all of us to lean into. Research is critical, like knowing that there's agency that improves because the kids participate in the program, that they have greater optimism for change, that there's a decrease in fast food consumption and these. Those are all really important stats, but this is what's most important. And it's not just that we have this physical change, but the kids who were involved in this will continue to be advocates for their communities and other communities because their voice was elevated. Because now they have the tools to create change in ways that are important to them. Not necessarily important to growing up Boulder organization where youth are a part of a system and they say, here are projects, do you approve? Consent. Or the Y Plan project where they engage in different ways. This is youth saying, this is what's important to us, this is what we want to see happen, and they have the tools to execute. I just highlight this because when we think about the levels of participation and the ladder of participation, again from the book, there are different ways that you can consider engaging with different parties, and everyone's not ready for the high level. And so I encourage you as you continue to do your work with community organizations, whether it's your research or in a class setting, or your own personal initiative, that you really assess at what level can I support this community so that we can build their capacity to get to the next level. Everyone's not ready for the high level, and that's okay. You meet the community where you are, where they are, not where you are. Meet the community where they are. Move at the speed of trust. Find your Bev Brody. Find your pastor like Jon Snow did and engage them where they are and help them build their capacity because they know what the true issue is, the true concerns are in their community. So I just want to say a special thanks to the Robert Wood Johnson Foundation and the Physical Activity Research Center for the support of this project. My lab, our clubs from Hawaii to Maine, our advisory board and club members. And then if you're interested in looking at the curriculum's actually been used most recently in New York City with Boys and Girls Clubs in Harlem. Dr. Leek, who's at Cornell University, she's extended this research there. And so there's the online resource. So let me just close by just saying a little bit about where we are at the Humphrey School and the kinds of things that I encourage all of us to invest in by way of our future generation. And so we have a diverse group of PhD students here who graduated this last fall. This is actually Rashad, who is now teaching at the University of Pittsburgh. He's teaching a class on City of White Supremacy, which is a fantastic offering. And we have other amazing students here. The way in which our society has moved from resource allocation, and I'm not talking about distribution of resources. I'm not talking about like distribution of financial resources, and but I'm just talking about the ways in which we allow youth to participate, to have their voice heard, to engage at any level. And it's not just what we open the door for in a kind of placative way, but true open access and engagement and participation. True participation, whether it's in their classrooms or on boards with local planning agencies or engaging in their local clubs. The youth really are the ones who are going to be shaping the future. Like, we can make decisions now for the next 50 years, but they're the ones who have to live with it. And so how do we have a succession plan for our communities and our planet? And it is by investing in youth. It's investing in middle schoolers. It's investing in high schoolers. It's taking the long view and supporting them, whether it's in a junior summer institute like we have at the Humphrey School, where we bring in college juniors to explore public affairs and international affairs and open this world to them in ways that were not open before. It's in K-12 programs like the Minecraft program that the United Nations runs to open up building communities in a Minecraft virtual environment to give these kids a view of what could be possible. It's the types of creative things we do every day here at the Weitzman School, Graduate School of Design. How do we extend that out to build capacity and agency and optimism for change for the kids that are right here in West Philadelphia? How do we do that better? I know that we can. And in so doing, we will create healthier places. Thank you so much.
Wow, thank you. We have time for a few questions. So let me open up the floor. First.
Really inspiring talk. And, I think the protection of public health, safety, and welfare is so absolutely fundamental. All professions that are represented.
Yes.
A question, and I suspect I might know part of the reason, but I may be totally wrong. In the CDC health impact pyramid,
Mhm.
high school violence was noted, but it seems to be, why is gun violence not on that?
The CDC was not really permitted to do research on gun violence for a long time. And what the CDC puts out is based on evidence that they can stand behind and they have a p-value on. And so because they had not been able to do research on this topic based on policies, they didn't have a p-value to be able to list it here.
So it's,
Politics.
There's some recent work done by a group in medicine, I think Hopkins, that lived in Philadelphia, and found very similar things, the factors that you identified also that reduce the possibility of gun violence.
Mm-hmm. Yeah,
Thank you.
you're welcome.
Amanda.
You raised your hand, Amanda.
Okay, so all of your research is basically what I'm doing, but I'm looking at it from like a trauma lens. So I'm a licensed social worker and mental health therapist. I used to be a high school teacher. So like my whole thing is like youth engagement in this exact same way, but rather than looking at like the physical health impacts, I'm looking at mental health impacts on trauma. I'm especially interested in the portion that's affected by gun violence. And that's like, this is like where I get stuck a lot. So I feel like I could literally talk to you forever, so I'm not going to take up more space than anything. But I'm just kind of curious who you may know who is doing similar work when it comes to the mental health piece. A lot of the times public health discourse on this issue talks about it like in broader terms, a lot more focus on physical health.
Yes.
And it'll talk about like increases and like optimism, like you said, but there's like, I haven't seen it or found any studies where they're looking at ACE scores, for example, and like trying to measure like, does this help coping skills, things like that. So I'm really trying to like find more direction and more discourse about mental health impacts, especially for teenagers, because teenagers are treated like children but looked at like adults. And so there aren't enough interventions that are really targeting that population, and they're not given a lot of agency.
Yes.
So I don't really know what my question was necessarily. I'm just like, all over the place.
Okay.
It's so exciting.
So I just want to highlight, so ACE, adverse childhood experiences, as in ACE scores, adverse childhood experiences. I point you to two places. One is Patrice Williams, Dr. Patrice Williams. She is a postdoc at MIT. She did a fantastic study, not on mental health, but on sleep. So she looked at the impact of gentrification and the threat of displacement on sleep quality in residents that were exposed to that gentrification and risk of displacement in Atlanta based on the Atlanta Beltline. She has her PhD from Florida State University and worked at NIH for a little bit and is now a postdoc at MIT. She's a fantastic scholar. You can find her work on Displacement Risk Index as related to sleep and sleep disorders in those impacted communities. So that's the one place I'd send you to. And then the other place is a children's think tank or children's research group in DC. The woman who runs it, her first name is NC, N-S-E. And I'm not remembering the last name, but it's a fantastic organization that has lots of research on pregnancy to about 18 or 23, because while you turn 18 and you think you're an adult, you really aren't an adult at 18 or 19 or maybe even 20. So from pregnancy, not even birth, from pregnancy all the way up to about 20-something years old. And so NC's organization has some really fantastic work that you can delve into. You're welcome, Amanda.
Thank you for this.
Good to
Really
see you.
Interesting and inspiring. I was wondering about the recent American Academy of Pediatrics, the new recommendations they have about obesity, which push really hard on the really big interventions in terms of drugs, prescription drugs, and surgeries, big interventions that are moving away from this sort of approach. I'm just wondering how you think about this, how those changed guidelines will affect support for this kind of work, how that changes things. I'm totally on board with this. I'm not critical of it at all.
Mm-hmm.
But that is just a really big push in another direction.
Right.
How does that change the work and that the research that needs to be done, but also the policy potential of this sort of.
So I haven't read the recent report, but what I think you're saying is that the National Academy on Pediatrics indicated that there needs to be this shift from behavioral and built environment approaches to a more medically oriented approach. I think the bottom line there is that when we think about medical interventions, the broad population doesn't have access to it. Either that they don't have the resource access or they don't have the cultural comfort access to these medical interventions. And while the built environment and behavioral change interventions are hard, we were gonna have dessert today. It was really hard for me to say no. It's hard, but it's the discipline in creating, not even the discipline, it's creating the context, like I said. So the healthy choice is the easy choice for everyone to make. So they realize that compound interest of positive health outcomes. I think the medical interventions is a shortcut. It's a Band-Aid that doesn't allow for that sustained impact and transformation in communities that costs a lot more than the medical intervention. So I haven't read the report, but that's what I would suggest. Now, let me say one other thing. Medical interventions are critical for a number of cases, but if we always go to the medical intervention, then we're not going to have a society that can operate on its own without that intervention, and then we're going to limit so much of our population from thriving and having health in that complete framework that is necessary. Thank you.
I think you mad when you read that.
Yeah?
It's really exciting. Did you mad?
Oh.
We had a couple other questions.
Hi, I'm Daniel, and I work at practice here at the university. We have a youth program called Design to Thrive. And we're currently working in West Philadelphia High School and bringing their space. We're with Amanda Design, design finance here currently. And we're working with high schoolers, you know, engaging with them to help build something that they helped create the idea for now. And so I was really interested in the part that you talked about the YAP program.
Yes.
They got the $80,000 to do the study, and then you showed a picture of kind of like the part being completed. I was wondering if you could talk more about kind of that, in between some more steps in there. Like, were they engaged in that actual day of? Like,
Yes.
Were they, you know, meeting teams? Like, if you could talk more about that, I would love to hear more.
Absolutely. So let me start with what the actual curriculum is and does. So the youth entered that 12-week curriculum just brainstorming what would a fun, engaged, environment look like for us. And that was maybe the first 2 or 3 sessions. In session 3, after brainstorming a few things of what excited them about their community and would lead to physical activity promotion, they kicked off the Who Dat game. So it's kind of like baseball cards, but of city council members. So exciting. So you'd show a card of a city council member, and the local Boys and Girls Club director would say, "Who dat?" And they'd say, "That's so-and-so, and they voted on this positively last time, but this negatively last time. This is who they represent." And they would just play Who dat every session. So by the time they got in front of county council, they knew who everyone was and how to craft their argument for those counselors who were present. They did, as they moved into weeks 4 and 5 or 5 and 6, they did the neighborhood assessments, the park assessments, they gathered data, they built their evidence-based argument, and then they said, well, if we're asking county council to do something, we should do something. So they did a park cleanup prior to completing the curriculum, and then they went to county council to present their recommendation. And county council said yes, but they didn't just say yes on the spot, right? For the kids, they thought, wow, you did such a great job. They said yes. But the local planner who was there worked closely with the Boys and Girls Club. Bev Brody, our door opener, worked closely with county council and just kept them abreast. This is what we're doing. This is what the kids are seeing. This is what they're saying. Come sit in on the session and hear them. So by the time the kids got in front of county council, they already knew what the presentation was, and they were ready to support. And so that's the work before the final presentation. That's the kind of support we can provide as adults and facilitators of change for these youth, so they realize success. That was a big ask. So when Bev and others said, this is what we're gonna pursue, I was like, oh, can we just request $1,000 to fix the rock wall? No, this is what we wanna do, and these are the foundations we're putting in to make sure they're successful. Let me give you an example that didn't work. So in DC, Northern Virginia, we worked with a club that wanted to have their track paved, the track at the school. And the track had the crushed gravel, and it hadn't been paved in how many years, and the grass was cut, but it was still crushed gravel. And this was a primarily Asian American community. And they said, our Omas and others are walking on the track. Sometimes they trip. It's really not comfortable. It's really dusty. But this is right near the house, and we don't have anywhere else to go. Can we get our track paved? Well, those of you who know school budgets, it just didn't work. There was no way they were even able to see any progress in that way. But they were able to move up the list. But for a 13-year-old, 12-year-old, moving up the list really isn't success. So we had to come up with some intervention that would allow them to see success. And so they created mile markers to put on the track. Those mile markers went in, look at what we did, a physical sign of our effort, mile markers. But the track hadn't been paved, at least at the time of that study. And so not only is it important to know where to engage your participants, where to engage communities, and how to support them in engaging in large processes, it's important to understand what is possible. So after they put in all this work, they actually have some level of success at the end. So $80,000, amazing. Let me tell you one other story. Our kids in Miami, one of the kids, the groups, basically they said, the water fountains are filthy. You make us go out and do this PE class that we don't want to do in South Florida, and we can't even drink from a clean water fountain. And they would, share this concern time after time after time, no movement. So what they did was they took pictures of the water fountain day after day after day after day for about 2 or 3 weeks. That was their presentation. And it changed the policy for janitorial cleaning at the school. So the water fountain is clean. Not only that, the principal goes out and gets his water every day from that water fountain near the gym, and they canceled the water that is in the principal's office. So he has to go out or had to go out to get water from that water fountain instead of having the water fountain in his office. Policy change, environmental change. So if the principal goes out and sees the water fountain's dirty, that's a problem. And this is also the place where the Yak kids wore their shirts every Friday because they were the Yak Club. So it doesn't have to be an $80,000 project. It just has to be a project that's important to the kids, and then they'll continue to advocate for other things that are important to them.
All right, you've had your hand up for a long time, so that'll be our last question.
Yeah, thanks for your presentation. I wanted to maybe go back to the point you had about how optimism for change only went up for suburban village children and not for urban. I'm just really curious why you think that might be.
So for the urban cohort, we don't have a good sense for why we saw the change in rural and suburban and not in urban. We think that the baseline for urban kids, urban communities is that much lower than for rural and suburban. We don't have the baseline, at least, we have the pre-post. So where the kids all started, and so that's calibrated to measure across the entire that population, but we don't know what that compound interest of disadvantage and concern and challenge was for urban, suburban, rural kids prior to participating. We think that may factor into it because again, there's the compound impact of everything that's come before that determines the extent to which you can realize that upswing. So we don't have a good understanding of it. Amber?
Follow-up question. So it wasn't, you couldn't see in terms of success of projects, right? So that wasn't really.
Well, we saw.
Measure success.
Well, we did see that each of the clubs realized successful impacts from each of their projects. We engineered it, especially the track. But what we didn't see, and I want to get to the results slide. So we saw, this optimism for change for rural and suburban kids, but we didn't see it for urban. And I think partly that there's been so much challenge prior for the kids in those communities that while it may have improved, it didn't improve statistically across the board. And then for increased active transportation to commute to school, I think our, and this is rural and urban students, but not suburban, I don't know. So this is great opportunity for additional funding to expand the research to answer these questions.
Thank you all for the good questions, for coming, and please join me in thanking you, Nisha Botchwey.
Thank you so much.